Good morning and good afternoon, depending on what part of Canada or the globe you are joining us from. Thank you for prioritizing the time today to join us at CGLCC's 2021 Digital LGBT Plus Global Business Summit New World. My name is Tammy Yates, and I am the Executive Director of Realize, a proud sponsor of the summit and of this next session. Realize is the leading national charitable organization working to improve the health and well-being of people living with HIV and other episodic disabilities across the lifespan through integrated research, education, policy, and practice change. This upcoming session on mental health is particularly important to us since some forms of mental health conditions are considered as episodic in nature. Can I be honest with you? Today's session on mental health in the new world is one that I think we all need right now. The unforeseen changes in work, life, love, and play have impacted all of us at Realize just as they have impacted you and your loved ones. Our lives reflect the realities of working during COVID-19 and have had to adjust to working while parenting young children, moving into new homes, coping with the death of loved ones, and concerns about family in other provinces, and if you're like me, concerns about family in other countries. Resilience amidst uncertainty, though, comes from the vulnerability to open ourselves to new information, experiences, and coping mechanisms. And with that being said, it's now my distinct pleasure to introduce today's session, Mental Health in the New World, a discussion about balancing entrepreneurship and mental health with Chris Ide, VP of Corporate and Community Partnerships at the Center for Addictions and Mental Health. This is such an important section. Thanks again for joining us. And as an ally to the community, I wish everyone happy Pride.
Good afternoon, everyone, and thank you for joining us here today. My name is Chris Ide. I'm the Vice President of Corporate and Community Partnerships at the Center for Addiction and Mental Health Foundation, or as we call CAMH. I use he, him pronouns, and it's my pleasure to be here to talk with you all about the relationship between mental health and work. It's a big topic, and I'm so happy to be here with you today. I'd also like to introduce my colleague, Christina Yeager, who will be helping me lead the Q&A. Christina uses she, her pronouns and is the manager of Rainbow Services, as well as concurrent outpatient medical and psychosocial addiction support services, or as we call COMPASS. I believe I got that right, Christina. Also at CAMH. Christina, just for a bit of background, she earned her Master's of Social Work from the University of Toronto, a Bachelor of Arts in Psychology, and a certificate in Lesbian, Gay, Bisexual, and Transgender Studies from Queen's University. And for the last decade, CAMH has been fortunate enough to have her providing direct clinical care to lesbian, gay, bisexual, and transgender communities. In fact, she was one of the first social workers in Ontario to be able to refer trans and gender diverse individuals for government-funded gender-affirming surgeries. I'll start by perhaps telling you a little bit about my mental health journey and why I care so deeply about this cause. I count myself amongst the global majority that has been impacted by mental illness. My brother-in-law, Pat, lives with a severe neurodevelopmental disability, anxiety, and obsessive compulsive disorder. My children's birth mom, who bravely decided to create an adoption plan for Elliot and Hudson, our incredible kids who I have no doubt you'll meet at some point today. She did so because she believed her mental illness would have prevented her from providing them with the kind of life she believed they deserved. And my husband, Nick, often says I drive him crazy, but as I've learned, that's not an actual diagnosis. So both my lived experience and my work at CAMH has really given me, I think, some unique insight into the important role that research and discovery plays in improving health outcomes, and how community partnership and partnership specifically with the business community can support and accelerate this work. And while the work of mental health has always been important, over the past 15 months, this work has really never felt more urgent. It's a consequential moment for mental health. In fact, it often feels like we're at an inflection point. It's been my observation that the conversation has really shifted from why should we care about mental health to how do we care about mental health? And this is particularly true of the business community. In fact, I would argue that the role the business community plays in supporting mental health outcomes has really never been more important. You know, Canadians have never been more ready to take up the cause and change the conversations in their own lives, and that includes in their workplaces. For those of you who are learning about the Centre for Addiction and Mental Health for the first time, we are Canada's leading mental health hospital and one of the world's leading research centers. We are based in Toronto. We treat more than 37,000 patients every year, living with all types of mental illnesses, from youth going through their first episode of psychosis to older people experiencing symptoms of dementia. We're the largest mental health teaching hospital in Canada and home to Ontario's only emergency department that provides 24-hour, 7-day-a-week assessment and treatment focused exclusively on adults experiencing mental health and substance use issues. And I would say our superpower, or what perhaps sets us apart from the rest, is that we have a mandate and a role to shape public policy at every level of government, municipal, provincial, and federal. Our goal as an organization is to create a world in which mental health is prioritized in the same way as physical health. A world where mental health is health. And over the past few years, we at CAMH have been putting a particular focus on workplace mental health and making that a priority, because we see the business community as allies and partners in advancing our cause, in helping more people access the care they need when they need it, and to live a life that's symptom-free and fully functional. You know, in fact, I'll speak a little bit more personally. I believe personally that mental health is one of the next frontiers of workplace inclusivity. Most of us spend the majority of waking hours on the job. And while I have found work to be a place of purpose and usually productivity, nearly half of working Canadians say that it's also the most stressful part of their day, which can be a large contributing factor to poor mental health. So by stepping forward to not only address, but to champion mental health in the workplace, business leaders have the opportunity, in fact, I believe they have the responsibility, to ignite and unleash employees' full potential. You know, the world, as we often say, was in a mental health crisis before the pandemic, including masks and lockdowns, became our new normal. And this crisis has been exacerbated by the pandemic. In fact, at the beginning of the pandemic, we would hear, and we still hear, people talk about the echo pandemic, or the second or third or fourth mental health wave. And what we've been doing is quick to remind people that there's only one pandemic, and it is impacting our health, both physical and mental, at the same time. For far too long, we as Canadians, but as the world as a whole, have put mental health on a back burner to physical health. And we know that these two things are intimately related and impact our overall health. For years, many Canadians have been carrying the invisible weight of stigma, stress, and illness. And in any given year, 1 in 5 of us, in fact, experience a mental illness, including addiction. And for many Canadians who work in office settings, the stress now lives where we live, as we've taken work into our living rooms, bedrooms, and wherever else we work in our homes. Like I said at the top, I will not be surprised if you get to meet my two 4-year-olds or husband during this call. They are homeschooling right now, which means making a huge mess of our basement. It's also been reported that 500,000 Canadians miss work each week due to mental illness. It's a leading and particularly expensive cause of disability in Canada. In fact, it's estimated that by 2041, the cumulative cost of mental illness in Canada will be 2.5 trillion, not billion, trillion dollars. Those are in both direct and indirect costs. And if there's one thing that this pandemic has made clearer than ever, it's that mental illness is an issue for all of us, regardless of what we do, where we're from, or what we look like. But for anyone from specific groups, such as non-white people, people experiencing poverty, and people from the 2S LGBTQ plus community, there are higher risks of some mental health issues due to discrimination and other social determinants of health. For instance, one study found that 33 to 55% of Black, East Asian, and South Asian employees reported being, quote, on guard at work to protect themselves against bias. Another study out of McMaster University found that half of people who identify as being part of the 2S LGBTQ plus community hid their sexuality at work in Sudbury and Windsor. We cannot expect people to be their best selves at work if they cannot fully be themselves. As we factor in the strain of the pandemic, it's really clear how much we address mental health now will set the trajectory for Canadian workforce and the economy going forward. So I've heard many stories. I've been working in this field for some time, and I have the privilege of speaking with many business leaders. And I've heard many stories from executives who have lived with mental illness and felt that they could not speak up about it. But the value of sharing your personal story from a leadership position is priceless. Right before Mental Health Awareness Week, at the end of April, we hosted 80 CEOs from across Canada to come and talk about workplace mental health and the future of work, specifically what was working and what were the limitations to creating a psychologically healthy and safe environment. And we then went into breakout rooms after like a riveting and harrowing keynote discussion from one business leader that really brought the audience to tears. In the breakout discussion, another CEO of a company disclosed that at the beginning of the pandemic, he had told his staff, including his direct reports and his board, that since childhood, he has suffered from depression. He said that in the week after his disclosure, his EFAP and benefits provider reported a 700% spike in outreach from their employers for support. And I think that's the power of being vulnerable, being bold in your leadership and vulnerable in your communication. You know, when you create the environment by sharing your own lived experience, it permits other people to come forward to share their own experience and seek the help they need when they need it. And while speaking about mental illness should be as simple as mentioning a physical one, the data shows that it isn't. Only 23% of Canadian workers would feel comfortable talking to their employer about a mental health issue. And I'll repeat that, only 23%. Add that to the emotional tax that the 2S LGBTQ plus community carries, and you can see why employees, specifically those of us in the LGBT community, might not speak up. You know, I've experienced these feelings in the workplace, both as a leader and as an employee. I recall one of my first jobs out of university. I came out when I was in university. As we did back then, we transitioned out of high school and came out in first year university. I count myself amongst that cohort, and lived out as a proud gay man ever since. And then I accepted this job, and it was an important job to me at the time. I came to work identifying as a gay man, and very quickly one of my colleagues told me that I should mind my pronouns when speaking about my boyfriend or my spouse, that, you know, he wasn't homophobic, but the president was. And that if I was out in the workplace, it would be career limiting. And not knowing much better at the time, I took the advice. And I, in my professional life, went back in the closet. I did not disclose my pronouns. I did not talk about the people I was dating in any specific way. And that manifested in some physical health issues. I remember going to the doctor and saying, my heart's fluttering, I'm losing my breath, I'm not sure what's happening. They did a bunch of tests to make sure that physically I was okay, and those tests came back saying I was. And I remember the doctor asking me if I was stressed out. And my favorite show is The West Wing. And I repeated what President Bartlett said: stress is not for me, stress is for other people. And then when I reflected on the stress that came with hiding my identity at work, having to choose between who I was authentically and progression in my career, it was manifesting in anxiety and in really physical ways. And while a lot has changed over the course of my career, the fact remains that the culture of silence continues to exist in many workplaces. An organization can implement all of the recommended policy changes it should, but if the workplace culture is not understanding and supportive of mental wellness and creating psychologically safe environments, employees will not reach out for help and will not prioritize their wellness. And you'll see the negative effects of this on your business: more absenteeism, people not showing up, and more presenteeism, people not showing up but giving their best. That will eventually cost our businesses good people and revenue. And if you're here today, you likely don't need convincing. The data around the human and economic costs of mental illness is well documented. Our own experiences in our families and in our communities and our workplace tell us really how urgent this issue is. But where leaders do need to help is understanding that they can do better to support their employees' mental health. Leaders can help them see that prioritizing and addressing mental health in the workplace is the right thing to do for employees and the bottom line. And when it's done effectively, the benefits to business include higher performance, lower absenteeism, and reduced disability costs. Plus, it's just the right damn thing to do. That's why in January 2020, CAMH launched its workplace mental health playbook for business leaders. So we had worked with CAMH researchers, clinicians, and experts for a number of years on a first of its kind, user-friendly playbook that would serve as a guide for business leaders like you on workplace mental health. And this research, this white paper, and this playbook was made possible thanks to some really incredible support from our lead corporate supporters, including BMO, CAA, and Dialogue. And if I'm being honest, it wasn't entirely easy to find organizations to come forward and champion this issue. Because at the time, we weren't just looking for philanthropy. We were looking for true partners in every aspect of the word to really stand shoulder to shoulder with us as leaders among Canadian businesses. We asked our partners to be vulnerable, to take stock of what they already were or weren't doing to support their employees' mental health. And I was really grateful to find these select partners who were willing to step up with us in these new ways for workplace mental health. The process showed us that no organization has all the answers and that we can all do better. And it reinforced the need for this research and this playbook. The playbook, really based on the best available evidence, provides a path to more effective solutions and better outcomes for employees and for businesses through 5 really powerful recommendations. The first of those recommendations is to create a long-term organization-wide mental health strategy. This strategy should work hand in hand with your overall business strategy. And as I mentioned earlier, for groups facing discrimination in daily life, such as non-white people or people who identify as being from the 2S LGBTQ+ community, the workplace can be a particularly strong contributor to poor mental health outcomes. This, emotional tax of having to hide who you are carries negative impacts for health that extend beyond the workplace, and it seeps into employees' personal lives. I've always personally been a big believer that employees are at their best and most productive when they feel free to bring their whole selves to work without fear of discrimination, bias, or being reprimanded. So again, it's so important for us as leaders to set the tone from the top. Instituting things like mandatory leadership training is really an essential part of any comprehensive strategy. And that means training for you. It will help you champion change and become more sensitive to employees' needs and identities. Ask yourself really important and sometimes challenging questions. Questions like, how can you reduce that friction that exists between work and life? How can you address job-related stress? Where is discrimination occurring in your organization? What kinds of supports do your employees want or need, and how will you measure success? One example, it's a large example, but I think it's a relevant one, is Maple Leaf Foods. Last year, they launched a cross-organization mental health strategy called You Are Not Alone. They worked with CAMH and engaged employees to develop this strategy that's based on 4 pillars: ease of access to effective supports, accommodation, stopping the stigma, and mental health training and education. And the suite of strategies under each of these pillars was informed by employees over 2 years, sending a clear message that leadership takes workplace mental health seriously, and their approach to supporting employee psychological health and safety was going to be an inclusive approach. Building on this first recommendation to create a long-term organization-wide mental health strategy, the second recommendation is about instituting mandatory mental health leadership training. Shifting your organization's culture to one that values employees' mental health starts at the top. Effective leaders have to be trained, invested in, and sensitive to issues employees face, because showing employees their workplace is safe and supportive will go such a long way in promoting more open conversations about mental health. There are many options for you, and they've proven to get results, from short 3-hour workshops to more intensive formal certification courses. Bell had done a partnership with Queen's University and Morneau Chappelle, which is now called LifeWorks. And there's a certificate program that I think is absolutely incredible. But whatever you choose to take, just make sure it's not just accessible to you, but also accessible to your team. Make it easy to access, and above all, make it mandatory to take. Because no matter what, the goal is the same: to engage and empower leaders as invested champions for workplace mental health. Recommendation 3 is to develop tailored mental health supports. Oftentimes, businesses come to us looking for that silver bullet, that one-size-fits-all solution to support employee psychological health and safety. And this process is more than just ticking a box. You have to tailor your programs to your employees' unique context. What might work for your business might not work for another. Think about delivery and access. Match the delivery to your employees' types of work. When we launched the playbook, we asked how many of your employees are working remotely, and make sure that it's easily accessed by remote workers. Now I imagine all of them are. How many of your employees are involved in physical labor? Are they unionized? What is the demographic makeup of these employees? And I can't stress enough the importance of inclusivity. Different cultures view stigma and mental health treatment in really different ways. Things like employee demographics and feedback should really inform what supports you decide to put in place. Take BMO for an example. They've seen really great results in this area. They're giving employees, dependents, and retirees access to a variety of programs that support mental health. They provide robust coverage, family and caregiver support, an EAP, as well as additional training and support. And taken together, these programs foster a culture that promotes mental health and wellness in the workplace and beyond. The fourth recommendation, perhaps the one that's generated the most interest, is about prioritizing and optimizing the return to work process. So if you are a small business owner and you do have employees, know that this can be a key opportunity to support your employees on their return to work. Their return to work shouldn't mark the end of your support for them. It's just a really critical stage in the support process. Some of the best practices include careful coordination and planning, taking accommodation seriously, and training managers to provide support. When we launched the playbook, we had a panel discussion that featured, among others, an incredible mental health advocate who also happened to work as a licensed funeral director. And she spoke so eloquently about everything her employer did right to make sure that she felt supported along every step of her journey, that she had time to leave, and that she was able to return to work at her own pace. And that support continues to this day. taking these steps, careful consideration, practicing sensitivity and compassion, can mean everything to an employee going through one of the most difficult times in their life. And fifth and finally, it might be the most obvious, but you need to track your progress. Like everything in business, we should be measuring performance. It's the keystone to a sound workplace mental health strategy. Good data not only shows what's working and what's not, it really ensures fairness and equity across the organization. Some indicators might include absenteeism, presenteeism, like I mentioned, and a successful return to work. You could even integrate things like, mental health into leadership evaluations for employee engagement surveys. And however you choose to measure success, I would encourage you to remember that mental illness in the workplace will never be eliminated. This is a continuous, lifelong journey of improvement. Create your future state. But once you get to your future state, that is going to be your current state, and you'll need to develop a new one. The journey to creating mentally healthy workplaces will never be complete. And I'll sort of wrap things up by just talking about COVID and putting mental health in that context. So when we published the playbook, we actually didn't know we were on the cusp of a global pandemic. No one did. So there's no denying that COVID-19 has transformed the way the world works. And our business has become really anything but usual. But even in the midst of a pandemic, what we've come to learn is that business leaders can rely on the playbook to build mentally healthy workplaces where everyone can reach their full potential. This resource is designed to stand the test of time, and it's become even more important as we navigate this next normal together, because let's face it, we all have more questions than answers, and CAMH is here to help you. So last June, as an addendum to the playbook, we published a COVID-19 supplement that's really designed to work hand in hand with the existing playbook to show employers how to support their employees through a pandemic and beyond. During the past many months, our CEO, my CEO, has asked us to focus on progress over perfection. I think it's fair to say that we are all doing the best we can, and some days we will do better than others. And so looking ahead, and perhaps what I'm asking all of you to do today, I challenge you to make workplace mental health a priority for your organization. Extend these efforts beyond human resources and help everyone, especially people in leadership positions, and that includes you, understand the critical role they play. Because the kind of change we're talking about really requires true champions and strong leadership from the top. When implementing these recommendations, I encourage you to be bold in your commitment and vulnerable in your communication. As entrepreneurs, many of you already wear many hats, but I'm proposing, I guess, one more hat for you to wear, and that's to be a normalizer in chief. Banish stigma by stepping forward to share your own journeys with mental health. Opening the door to these conversations can save lives. Guide them to lead the way and inspire others to follow. And I will promise you this, it is not always going to be easy, but it will be absolutely worth it. And if you'd like a copy of the playbook or want to know more about the community CAMH is creating, I would encourage you to go to camh.ca/businessleaders. There you'll also find resources that we've developed to help the general public and healthcare workers cope and build resilience during this time. Those are also found at camh.ca/COVID-19. We offer a wide range of help for you to manage mental health and lots of access to supports and resources specifically about workplace mental health. So I just want to thank you for your time. I see that we've had a number of questions come in, and bear with me as I bring those up, and maybe bring Christina in to see if she's had an opportunity to take a look at them, or might be able to answer them.
Sure. Well, thanks, Chris. And thanks so much for your talk. I guess I just want to echo what your encouragement of that that extra hat of normalizing people's well-being and mental health. I resonate so much with your situation in your first job that you took, and feeling like being out was not a safe thing to do. I think as leaders, I've had a very similar experience myself, and have had the great privilege to have worked for the last 11 years here at CAMH in two of our specific LGBTQ2S programs, the Rainbow Services, which I'm now the manager of, and our Adult Gender Identity Clinic, which I worked in for a number of years as a clinician. And I was super lucky that part of my role was being out and honest with my team and with our clients around my own sexual orientation. And so I'm very aware of how lucky I was in that role for my own mental health to come to my work as my true self. And so I guess what I'm in echoing what you said about, that having that hat of normalizing people's experiences, and we know in our work with clients and our community members who are struggling with substance use and mental health, who are part of our communities, is that being worried about what's going to happen to you because of your sexual orientation and gender identity creates mental health concerns in itself. So we have higher prevalences, as you described, of mental health concerns in our communities, not because there's anything wrong with it, but because we're worried about how people are going to treat us. So, so as leaders, being able where you can to be the safe place to land in terms of people's sexual orientation and gender identity in itself is a mental health intervention. Using people's pronouns, using people's being a safe space, and having organizational policies that reflect that and affirm people's gender identities and sexual orientations in itself is a mental health intervention. So that's, but I don't know if you want to answer the first question, Chris.
Sure, I will. Thank you for sharing that, Christina. You guys are doing such great work at CAMH, and a privilege to see that work and leadership in action. So one of the first questions is, are there any short-term goals workplaces or entrepreneurs can take on to promote psychologically safe and healthy workplaces? I'll perhaps just pick up on one of the themes that I think has run through, what I just talked about, but often what I remind leaders at any sized organization, whether it's a small business, they're an entrepreneur, medium-sized enterprise, or the likes of BMO and Maple Leaf Foods. Share your experience, right? Be that normalizer in chief. One of the questions that we often get from some organizations, well, how much does this cost? How much would it cost to create a psychologically healthier and safe work environment? And I answer that in two ways. One, we know from major organizations and a report by Deloitte that for every $1 invested to support employees' psychological health and safety at work, there's an average of $4 return on that investment. But two, it costs nothing to be vulnerable and to share your personal lived experience with mental health with your employees. You saw what happened with that CEO at the Business Leaders Summit who shared their experience with depression since childhood. It was really interesting to hear him. One of the follow-up questions was, well, how did the board respond? How did your direct reports respond, and how did the staff respond? And the staff and his direct reports responded with incredible support and were entirely gracious. The board needed education on mental illness. And so, perhaps one of the other short-term goals is take some time to educate yourself about mental health and mental illness, and understand that these things are on a spectrum. We all have mental health. The question is, what is the quality of the mental health that we have, and when does that quality become so degraded or low that it enters into a mental illness? CAMH has some really amazing educational tools and resources online, so I would encourage you to go to camh.ca and take some of those online courses to give you that baseline information and knowledge to start having these conversations and educating yourself about mental health, mental illness, how it might manifest in the workplace, and what your role is as a leader. I see another question, Christina. I don't know if you want to talk about CAMH's pivot to virtual services. The question is, now that many of us are working virtually, how can you best support employees? Perhaps maybe if you want to share some information about CAMH's pivot to virtual services. We are an employer of 3,500 people, so I think entirely relevant.
Yep, totally. So of course, CAMH was treating most folks in person until the pandemic came. And I think we found actually great opportunity in pivoting to virtual. And we will probably continue to do a hybrid model of care over time as we hopefully at some point get to return more to work in some ways. I think virtual care will continue, which is actually great for access to care. So as an example, Rainbow Services, we were actually the first of the whole hospital to start our groups in virtually. And so we were able to bring our program entirely back to the community virtually. And Rainbow Services treats LGBTQ2S individuals who are looking to work on their substance use and concurrent disorders. And so we were lucky to be able to pivot to provide that care online through like a totally secure through WebEx. That's all compliant with the hospital's privacy regulations. What's interesting in COVID is that for the 11 years that I've been connected to Rainbow Services, this is the first time we've had a wait list. And our wait list is long and it's months long, and that is new. So what that really says is our communities are struggling and they're needing support, and people are attending our groups and staying, which is very interesting. Like, our dropout rate is very, very low. So it's really highlighting the need. What it's also highlighting is the opportunity, I think, as employers to be able to, for your employee to attend a treatment program. It's like a click and a click, right? From their, whatever they were doing in terms of their virtual work at home already. So we have people who have, 9-to-5 jobs who otherwise wouldn't be able to attend our groups, but because they're doing it from the same place that they're working, they're able to attend. So what I would say is, supporting team members virtually during this time, there's opportunities to participate in treatment programs that your employees and our community members would not have had the chance to do before, with commuting to and from to groups in the middle of the day. So this is actually an opportunity, and I would just really underscore normalizing the fact that people might need to take breaks in their days to attend treatment, whatever that might look like. Private therapists, our publicly funded system here. So I would just encourage employers and leaders to give their employees the space and time to do that, because it's probably the least costly these days in terms of employees stepping away from work for a shorter period of time than it's ever been.
I love that. I didn't know that you guys were the first to pivot to virtual care. I know it's been a big focus of CAMH's care overall. That's awesome to hear.
Yeah, our clients weren't going to let us be offline for too long. They really wanted to come back to the group. So
fair enough. And I'm always dismayed to hear about wait times. But if I'm the eternal optimist and looking for a silver lining, it's that more people are willing to put their hand up and look for help. And so I think that ultimately is a good thing. Another question, perhaps the final one, what is the cost of not having free and safe workplaces? This is an interesting one. $2.4 trillion to the Canadian economy. But I'd say that's not even the most significant cost. The significant cost is loss of life. And by that, I mean loss of somebody being their best version of themselves, feeling supported and loved and cared for, being able to bring their authentic and true selves to their workplace, and knowing that their workplace is a safe environment. There's the ultimate consequence of untreated or undiagnosed mental illness is death by suicide. 800,000 people globally die by suicide every single year. Sorry, I will change that. That was the stat last year. This year, that stat went up to 1 million people globally died by suicide. In Canada, last year, that was 4,000 people, or 11 per day. The cost is incredible. And I think it's the business community and us as leaders in the business community and entrepreneurs that can have a huge impact in terms of advancing the cause of mental health and making sure that mental health is one of the next frontiers of inclusivity in the workplace, and that we lend our voices and leadership to this cause to make sure that people know they're not alone and know there's support and partnership and friends and allies out there who are willing to help them along in their mental health journey. Okay. All right. I see we are at time. I want to thank everybody for participating. I also want to thank Canada's LGBT+ Chamber of Commerce for creating this opportunity. It's been an absolute privilege and honor. And happy Pride Month, everyone. I hope you have an amazing one. Thank you.
Happy Pride.